Today we're going to talk about a condition that affects millions of people worldwide, yet can often be misunderstood. It's called multiple sclerosis, or MS. At its core, MS is a long-term disease that impacts the central nervous system, which includes your brain, spinal cord, and the optic nerves in your eyes. These are the command centers of your body, responsible for everything from walking and talking to thinking and feeling. When MS occurs, the communication between your brain and the rest of your body is disrupted, leading to a wide variety of unpredictable symptoms. It's a journey that is unique to every single person who has it. So, what exactly is happening inside the body? MS is what we call an autoimmune disease. Your immune system is designed to be your body's protector, fighting off foreign invaders like bacteria and viruses. However, in an autoimmune condition like MS, the immune system gets confused. It mistakenly identifies a healthy part of your own body as a threat and launches an attack. In the case of multiple sclerosis, the immune system specifically targets a protective substance called myelin. This process of the immune system attacking its own tissues is what causes the inflammation and damage that define the disease. To understand this better, let's use a simple analogy. Think of the nerve fibers in your brain and spinal cord as electrical wires. Myelin is the protective insulation that wraps around these wires. This insulation ensures that the electrical signals, or nerve impulses, travel quickly and efficiently from your brain to their intended destination in your body. When the immune system attacks and damages this myelin sheath, it's like the insulation being stripped away from the wires. This leaves the nerve fibers exposed and vulnerable, which can slow down, distort, or even completely block the messages being sent through the nervous system. This disruption in communication is what leads to the symptoms of MS. Depending on where the damage occurs, the effects can be very different. If a nerve that controls leg movement is affected, you might experience trouble walking. If the damage is to the optic nerve, it could cause vision problems. The name multiple sclerosis itself means many scars, referring to the multiple areas of scar tissue, or sclerosis, that form in the brain and spinal cord where the myelin has been destroyed. These damaged areas are also known as lesions, and they are the hallmark of the disease. One of the most challenging questions in medicine today is, what causes multiple sclerosis? The honest answer is that we don't know for certain. Researchers believe it's not one single thing, but rather a complex interplay of several factors that come together to trigger the disease. There isn't a single MS gene, but genetics do seem to play a role. Having a close relative, like a parent or a sibling, with MS slightly increases your own risk. This suggests that certain genetic variations can make a person more susceptible to developing the condition when other triggers are present. Environmental factors are also a significant piece of the puzzle. It's been observed that MS is far more common in countries that are farther away from the equator. This has led scientists to investigate the role of vitamin D, which our bodies produce when exposed to sunlight. Lower levels of vitamin D have been linked to a higher risk of developing MS. Other environmental factors, such as exposure to certain viruses like the Epstein-Barr virus, which causes mono, and even smoking, have also been identified as potential contributors that could awaken the autoimmune response in a person who is already genetically predisposed. Ultimately, MS is a malfunction of the immune system. We've discussed how it mistakenly attacks the myelin, but we don't fully understand why it begins this attack in the first place. The leading theory is that a combination of a person's genetic makeup and an environmental trigger, like a viral infection, sets off a chain reaction. This reaction programs certain immune cells to see myelin as a foreign invader. Once this happens, these cells cross into the central nervous system and begin their misguided assault, leading to the inflammation and nerve damage that characterize the disease. While MS can affect anyone, certain patterns have emerged. The disease is significantly more common in women, who are diagnosed about 2 to 3 times more often than men. The onset of symptoms typically occurs in young adulthood, with most people receiving a diagnosis between the ages of 20 and 50. It's a condition that often strikes people when they are in the prime of their lives, building careers and starting families. Understanding these risk factors helps us identify who is most vulnerable, and guides research toward finding the root causes and, eventually, a cure. Because MS can affect any part of the central nervous system, it can produce a vast and often bewildering array of symptoms. These signs can vary greatly from person to person, and can even change in severity for one individual over time. Among the most common early physical symptoms are issues with vision. This might present as blurred vision, double vision, or even a temporary loss of vision in one eye, a condition known as optic neuritis. Many people also experience numbness, tingling, or a pins and needles sensation, which can occur in the face, arms, legs, or torso. These feelings might be mild or so severe that they interfere with daily tasks. Fatigue is another incredibly common and often debilitating symptom of MS. This isn't just ordinary tiredness. It's an overwhelming sense of exhaustion that isn't necessarily related to the amount of activity or sleep a person gets. It can profoundly impact a person's ability to work, socialize, and enjoy life. Problems with balance and coordination are also frequent, leading to dizziness, vertigo, and an unsteady gait that can increase the risk of falls. Muscle weakness, stiffness, or spasms, known as spasticity, can make movement difficult and sometimes painful, further challenging a person's mobility. It's crucial to understand that MS is not just a physical disease, it also affects mental and emotional well-being. Cognitive issues, often referred to as cog fog, are very common. These can include problems with memory, attention, information processing, and problem solving. It might become difficult to find the right word or to multitask effectively. Alongside these cognitive changes, many people with MS experience emotional shifts. Depression and anxiety are more common in people with MS than in the general population, stemming from the challenges of the disease itself, as well as the neurological changes it causes in the brain. The course of these symptoms is often unpredictable. For many people, symptoms appear during periods called relapses or flare-ups, which can last for days or weeks, and then they may improve or disappear entirely during periods of remission. This is a common pattern in the most prevalent form of the disease. For others, symptoms may not come and go, but instead build up and worsen steadily, over time. This variability is one of the most difficult aspects of living with MS, as you may not know what to expect from one day to the next. Diagnosing multiple sclerosis can be, well, a pretty complex process because there isn't a single definitive test for it. The symptoms can mimic many other conditions, so doctors must act like detectives, carefully ruling out other possibilities. The diagnostic journey typically begins with a thorough review of your medical history and a detailed neurological exam. During this exam, a doctor will test your vision, strength, coordination, reflexes, and sensation to look for any abnormalities that might point to a problem within the central nervous system. This initial evaluation is a critical first step in piecing together the clinical picture. To confirm a diagnosis, doctors rely on several key tests. The most important of these is the magnetic resonance imaging, or MRI scan. An MRI uses powerful magnets and radio waves to create detailed images of the brain and spinal cord. In a person with MS, the MRI can reveal the characteristic lesions or areas of scarring where myelin has been damaged. Doctors often use a special contrast dye during the scan to show if there is active inflammation, which helps differentiate new lesions from old ones. This provides evidence of damage happening in different places and at different times, a key criterion for an MS diagnosis. Other tests can provide additional supporting evidence. An evoked potential study measures the electrical activity in the brain in response to stimuli, such as looking at a screen or hearing clicks. Slower response times can indicate that nerve signals are being impeded due to myelin damage. In some cases, a spinal tap or lumbar puncture may be performed. This involves collecting a small sample of cerebrospinal fluid, the fluid that surrounds the brain and spinal cord. The presence of certain proteins and immune cells in this fluid can be another strong indicator of the inflammation associated with MS. Once a diagnosis is made, your doctor will determine which type of MS you have, as this affects the prognosis and treatment plan. The most common form, affecting about 85% of people at diagnosis, is relapsing remitting MS, or RRMS. This type is defined by clear relapses of new or worsening symptoms, followed by periods of partial or complete recovery. Secondary progressive MS, or SPMS, can develop later in people who start with RRMS, where the disease course shifts to a steady worsening of symptoms over time, with or without relapses. Primary progressive MS, or PPMS, is less common, characterized by a slow but steady progression of disability from the very beginning, without distinct relapses. While there is currently no cure for multiple sclerosis, the landscape of treatment has been, honestly, transformed over the past few decades. The importance of an early diagnosis cannot be overstated. Starting treatment as soon as possible can help slow the progression of the disease, reduce the frequency and severity of relapses, and manage symptoms effectively. The primary treatments for relapsing forms of MS are a class of drugs known as disease-modifying therapies, or DMTs. These medications work by calming or suppressing the overactive immune system to prevent it from attacking the myelin, thereby helping to protect the nervous system from further damage. Managing the specific symptoms of MS is another cornerstone of care. This often involves a team of healthcare professionals. Physical therapy can help with mobility, strength, and balance, while occupational therapy can provide strategies and tools to make daily activities easier. Speech-language pathologists can assist with any issues related to speaking or swallowing. Medications are also available to treat individual symptoms like fatigue, muscle spasticity, pain, and bladder problems. A holistic approach that addresses all aspects of the disease is key to maintaining the best possible quality of life. Lifestyle choices also play a powerful role in managing MS. Regular moderate exercise has been shown to help with fatigue, strength, and mood. A balanced, healthy diet is important for overall wellness and can help manage energy levels. Getting enough rest and finding effective ways to manage stress, such as through mindfulness or yoga, are also incredibly beneficial. Quitting smoking is one of the most important steps a person with MS can take, as smoking is known to accelerate the progression of the disease. These proactive steps can empower you to take an active role in your own health. Living with a chronic illness like MS can feel isolating, but it's important to remember you are not alone. Building a strong support system is vital. This includes your doctors, nurses, and therapists, as well as your family and friends. Connecting with others who have MS through support groups or online communities can provide invaluable emotional comfort and practical advice. Today, thanks to incredible medical progress and a growing network of support, people with MS are living fuller, longer, and more active lives than ever before. If you notice any symptoms, please seek help. There is hope, and there is help available.